Assalamu alaikum, the communication day. The first scenario, you are the medical registrar in the acute medical unit. Mr. Raymond Barnes, a 58 years old man with chronic obstructive pulmonary disease, known case, has been admitted with acute breathlessness. His chest X-ray reveals a large left-sided pneumothorax. The decision has been made to insert chest drain to remove the air and allow the lung to expand. You have been asked to discuss the procedure with Mr. Barnes and obtain informed consent. He appears anxious and confused about what the procedure involves. Your task is to explain the situation in plain language, outline the procedure risks and benefits, address his concern to ensure informed voluntary consent. Yes, you can start now.
Hello, I'm Dr. Muhammad. I'm doctor in clinic today. With me, Mr. Raymond, 58-year-old.
Oh, yes.
We are here today to discuss some health issue with you. All our talk
Would you mind just speaking up a bit?
We are here today to discuss some health issue for you. All our talk will be confidential. It's okay for you?
Yes, please. Yeah.
Okay. Firstly, Mr. Raymond, can you tell me how much you know about your condition to be on the same page?
Well, I came in with severe shortness of breath, and I have COPD, and I take my inhalers. I've been smoking for the whole of my life, but I stopped last year. Anyways, they've told me that there is air in my lung, and they're trying to get it out, but I don't understand.
Okay, I appreciate your knowledge and your concern, Mr. Raymond. What's your expectation about this procedure today?
Well, I've been told that the procedure will alleviate the symptoms.
Okay, Mr. Raymond. And how are you now? You are better after putting oxygen? You are better? Getting better?
I think I'm a bit better, but still I'm feeling a bit more short of breath than usual.
Okay, Mr. Raymond, sorry for that. We are here all to help you. And that's why
you.
we are here. Firstly, Mr. I need to explain more about your condition, about this chronic obstructive pulmonary disease. And this is will draw for you. This is some dilatation of your sacs, of air sacs in the lung. One of this due to, as you mentioned, the prolonged smoking, and one of these sacs ruptured and caused this air suddenly for your some coming with cough, causing this breathlessness you have. You are with me, Mr. Karim? Hello.
Hello, sorry.
You are with me. You are with me.
Yes, I'm following you. Yeah.
So come suddenly to your around the lining layer of your lung, causing this shortness of breath and the breathlessness that you have. That's why the team here decided to put this tube, chest tube. How much do you know about this tube, Mr. Raymond?
Nothing, actually.
I will tell you more about this.
Yes, please. I would appreciate that.
I will continue to draw for you. At the site of the lung that have this air, we will numb this area, and by some numb doctor to feel less pain, and with small puncture and small neck, we will put a small tube, very small, to remove this air. And we will be sure that we have to take some lab to be sure that your blood count is okay for doing the procedure. And after that, we will follow you by imaging to confirm the position of this tube as I draw for. Are you with me, Mr. Raymond?
Yes. How long does it take to put the drain in?
Okay, Mr. Raymond, I appreciate your knowledge. This is different from person to person. Sometimes days, sometimes more. But we will follow you and monitor you closely by lung doctor and surgical doctor. Once we feel the lung is okay, they will take the decision on the optimum time for you, with following by imaging and following you closely for that. As usual for many procedures in medicine, sometimes they have some risk, some benefit, but here you have more benefit than risk. Some bleeding can occur, some infection can occur, but we will follow that closely to control it as early as. Are you with me, Mr. Raymond?
Yes. So you're gonna put a drain in, and that drain will take the air out, and it's gonna stay a few hours or some time, or 1 day or 2 days, depends. And you did mention the benefits is more than the risk, but what are the risks?
Yes, I appreciate your knowledge now. And other way, if we didn't put this tube, as I draw for you, this air will be increased and compress your lung more and may affect your life. So it is very important and very life-saving procedure. Is it okay for you, Mr. Raymond?
Sorry, can I clarify? You did mention that it might affect my breathing. Do you mean that
Yes, I am with you. I'm hearing
there
you.
is no way to get it sorted apart from that drain?
Sometimes we can do some small needle, the drain, but in your case, the team decided that the rest of your condition better to this drain to remove the air as early as possible. It's better to
And
release
if we
your.
did not put a drain in, what will happen?
As I told you, Mr. Raymond, it is a life-threatening condition. If we don't put this drain, this air will increase more and more, causing compression of your lung, and everything will be more worse and may affect your life. Honestly, I can tell you like this.
Okay, it sounds serious.
Yeah. Okay, Mr. Raymond.
Yeah.
Now, doesn't for you, you are ready to put this drain?
Sorry?
You are ready to do this procedure?
Oh, yes, yeah. But did you tell me about the risks? What are the risks? If, like, when you put the drain, what are the risks?
Yes, I mentioned for you, there is some, as all medicine and all procedure, we have some risk and benefit, and here the risk will be some bleeding, some infection, bugs, some injury to the nearby. But we have here expertise hand. They did it many times without without this risk. And even though we will follow you closely for this complication to control it early, no guarantee 100% in medicine, but we are here. Okay.
Okay.
If you are ready now, Mr. Raymond, we have the paper consent.
Yeah.
All information we did for you. It is ready in all benefit and risk to sign it to start the. Okay.
Okay. Thank you.
For now, Mr. Raymond, I need to tell you. What's your job? Hello.
I think the voice is breaking up. Hello?
Hello. What's you are doing for living, Mr. Raymond?
What? Sorry, what?
What's your job, Mr. Raymond? What you are doing for living?
I am a carpenter.
Okay, Mr. Raymond, we are here any financial support.
I'm really sorry. The voice is breaking up.
Any support, Mr. Raymond, you want? You need?
No, thanks.
Okay. Also, I need to advise you what about smoking?
I quit smoking last year.
And still smoking?
No, I quit smoking last year. I no longer smoke.
It's a very good decision. This is very helpful in your condition. And
2 minutes left.
I will give you some brochure now until we prepare for the procedure. This
Okay.
more, if any other concern of any other information you want, you can ask me. We are ready to answer anything. Okay?
Okay. Thank you.
Any other concern, Mr. Remo?
No, thanks. When can you do the procedure?
Once after you write the consent is ready and we are.
Are you gonna do it or someone else?
You are now heard my all the information about it. Any information not clear for you?
No, all is clear. Thanks.
Okay, and you repeat it for me clearly that you know everything, so you you can do the consent, and immediately you will be prepared to start.
Yeah, so you told me about the chest drain, and it's very important to save my life. It might come at some risk, but like bleeding or infection, but I very much need it, so I don't have a choice. As far as I understand, it should be straightforward, but some complications can happen, and you'll watch out for any complication. And I appreciate your time. Thank you.
Okay. I appreciate your knowledge, Mr. Raymond. Any other concern for now?
No, thanks.
Okay, thank you, Mr. Raymond. Thank you.
Okay, it's 5 and maybe less than 10 seconds remains. But please, Dr. Muhammad, change your connection. There is some interruption all through the
Okay.
scenario. Yet, or maybe the Bluetooth, I don't know, or the connection. I think connection itself, the internet. Try to fix.
I will came out and
Yes, please disconnect and reconnect back. Dr. Inas will comment, then we'll be back with my comment. Yes, Dr. Inas, please, you can start.
Um, First of all, very well done. I think main points have been covered, like you checked understanding of the patient, what is the condition, what is the procedure, and what is the indication of the procedure, and what is the risk of not having the procedure, which is very important. And he commented on the risk of the procedure itself. In this area, I would have elaborated more that risks could be infection, but I'm gonna be like using antiseptic technique, and all of my instrument would be with antiseptic technique, so the risk of infection is small. However, if that happened, you need to watch out for redness, discharge, or pain around the area, and let us know, and we can give you some antibiotic. And the other risk is the pain itself from the procedure. And I will reassure, so I will mention the risk and I will reassure the patient, say like pain, but you'll be happy to know that you wouldn't feel this very painful, because we will put a local anesthetic, a numbing agent. You might feel a bit pushing and pulling, but you're not gonna feel it is painful. But if you feel that it is painful, please let me know so that I can put more local anesthetic. And because we do this procedure with an ultrasound, the risk, or at least in the UK, we do it with ultrasound, the risk of injuring other surrounding structures like arteries or veins or nerves is very minimal. And we go in an anatomical not anatomical, we go in a safe window to put that drain, so the risk is very theoretical to have complication, but we make sure that we do everything as per the guidelines, etc. So I've just mentioned the risk and to reassure what we do to prevent them, and then asking the patient again to recap what happened. That this is very important, particularly in terms of the consent, because you need to assess that the patient is able to communicate and is able to retain information. So that was very well done. And at the end, so a lot of time, particularly in the UK, whenever they have a procedure, they will just give the patient a leaflet and they're just like, okay, if you want to read about it, and I'll come in 30 minutes and we can discuss it. By that time, the patient would have read about the procedure and they have some questions. So whenever they consent, it is really informed consent because they know about the procedure. And at the end, I think you can summarize that we've discussed this. You already actually summarized. We're gonna do this. We're gonna do this. And very good that you asked me. Now we need to sign the consent. You may wanted to add that now I'm gonna document this clearly in your notes, like just to be medico legally in the right direction. And after that, I would add a bit of safety netting. If you felt severe pain, if you had discharge, if you felt the tube is leaking, if you had fever, etc., just make sure that you let us know as soon as possible so that we can act on that. But overall, that was very well done. Thank you.
Yeah, thank you, Dr. Inas. Would you like to add hidden point here in this scenario? What do you think? Maybe it will be raised by the surrogate, or the other point might be raised by the candidate. What do you think, Dr. Inas? So what the point can be raised by the surrogate here? and it's very common.
Maybe like a relative who has had a chest drain and the chest drain has complications.
No, you already raised. I mean about the flight or flying. Flight. If I
Oh,
have flight, yeah. It's one of the points very important with any pneumothorax patient.
Flight and
Unless,
swimming, Dr. Bassem, please.
sorry,
Flight and swimming.
diving, you mean diving, yeah.
Diving.
Diving, you have to raise it by yourself. If you have any hobbies, he will tell you or she will tell you, yes, doctor, I like to do diving, scuba diving. So you have to prevent, or you can mention it's prohibited to do this after or even after the removing of the tube, because it might re-accumulate the air and it might cause pneumothorax again. For the flight, it might be raised, or the job would be as pilot. In this point, you have to refer him to the surgeon, and we will let you know when you can fly. Supposed to be 6 weeks after the drainage, or sorry, supposed to be 2 weeks after a drainage if he is a passenger, and 6 weeks if he is a pilot.
okay.
Okay,
So two
yeah,
weeks if a passenger, 6 weeks if a pilot.
yeah.
And
After resolving of the pneumothorax, so you have chest X-ray, and you after removing the tube with no any residual pneumothorax, so the patient as a passenger he can fly. If he is he is flying as pilot, he should wait for 6 weeks, following the guidelines of the aviation regulation. Clear? So be ready whenever you have pneumothorax scenario, either to have it as pilot as a job, or the patient will tell you, I want to fly to my uncle or my cousin or whosoever. Or you have to raise the issue of diving, scuba diving.
does it matter if it is primary or secondary in these kind of conditions?
I think nowadays the guidelines change regarding primary or secondary. It will be the same
Okay.
as long as there is. But anyway,
So
anyway,
diving, no
yeah,
diving at all.
yes, unless the patient will do bullorectomy.
Oh, I see. Fair enough. Okay. Yeah, that makes
Okay.
sense. Thank you. Thank you. I
Yeah.
didn't know that. Yeah.
The other points for any procedure, as Dr. Muhammad do or did, it was before and during and after, right? But please add some observation. You mentioned it closely observation for how many hours, and for how many. You mentioned also for how long the patient will stay with this chest tube. So it depends on the cause, depends on the response from patient to patient. I think also Dr. Muhammad covered this point. So before as you said, the investigation, some blood test to confirm you don't have any bleeding tendency, and you'll be admitted, you and shifted to the theater room and the or procedure room. Then during you might have numbing area to the part or the area the needle will pass through. After that, you can draw, of course. So I will draw for you. Then we will put the tube, hopefully without or with minimum pain. We will be sure that you don't have any pain, and so on. Moreover, if you have the complication might happen, pain and bleeding, infection or injury to the lung itself, even, or any blood vessel, you might have some blood coming. And after observation, doing chest X-ray to confirm the position, and we will do follow up and monitor the tube and the drain itself. Yeah, and it needs some days to resolve. Then after the air removed and the lung fully expanded, we might remove this tube. The risk or the seriousness of not having the tube is very important to mention. Why? You have to convince your patient. We have to do this procedure. Why? As Dr. Muhammad said, if not treated or drained, it might being enlarged, and it might affect the lung and the breathing as you have breathlessness. Even moreover, it might lead to more breathlessness and might threaten your life. They are focusing on the seriousness of not to be treated, not only in pneumothorax, in any scenario. Hepatitis C, counseling, rheumatoid, MS, any patient you are going to explain a medication or explain the disease, you have to convince the patient that if you are not treated, you might have complication. Why? Because some patients are very reluctant to start the medication. Doctor, I don't want. I feel there is some side effect from the medication. I feel there is complication from the procedure. However, the importance of doing this is to prevent the life-threatening complication. Like in this scenario, yes, there is life-threatening complication might happen, which is tension pneumothorax. Even it might threaten your life. Consent form you did, and the social support. Here you can add the question for hobbies. Do you have any hobbies? Put it always whenever you have pneumothorax patient or any patient with like epilepsy, for example. Patient with epilepsy, you should ask about the hobbies. If he's going hiking or doing swimming, he should be observed. So there is some disease you have to ask about hobbies as well as related to the job. If he has risky job, he should be also monitored. Like carpenter here also, if this carpenter is having epilepsy, is it dangerous to have epilepsy to this patient? Yes, if he has the seizure
Yeah, it
while
is.
yeah. So you might reallocate him in another job which is more safe. Okay.
Yeah.
Yeah. Thank you, Dr. Inas and Dr. Muhammad. Any question? Dr. Inas or Dr. Muhammad?
I just have a question, if you don't mind.
Yeah,
Uh,
sure.
You did mention the rule of the surgical intervention. Was it mainly for pleurectomy or was it for something related to the chest drain?
Perfect. What do you think the indication of pleurectomy in pneumothorax patient?
Well, I think if it's recurrent,
Exactly, yes, this is the point. Yeah, this is the answer. Whenever he has recurrent pneumothorax or pneumothoraces, the pleurectomy will be the option for the treatment as a surgical definite treatment. Okay.
yeah.
Any other question?
No, thank you very much.
Okay. Yeah. So be ready for your scenario, Dr. Inas. As I mentioned, the functional illness. I will read it quickly. Then I will come to the comment in the chat box. Patient had suddenly Mr. Farouk. He is 50 years old. He has developed difficulty of walking and his gait was ataxic on inspection. He was brought into the emergency department by his friends and urgent assessment was done. Clinical examination of her nervous system is unremarkable. If his nervous system is unremarkable, including cerebellar signs and long tract the consultant neurologist has confirmed that he has functional illness and no further test would be essential. Your task is to explain the clinical diagnosis of Mr. Farouk about his functional illness and discuss the further management plan with him. Be ready, Dr. Inas. I will read the comment only down in the chat box. Dr. Huda asking by airplane. Yes, this is the point. Dr. Inas wrote, you did mention the role of surgical intervention was that mainly for pleurectomy. Yeah, the chest tube itself is a surgical option. So the non-surgical option will be observation. Whenever you have less than 2 centimeter pneumothorax, along with no symptoms, right? If the patient is symptomless and the pneumothorax less than 2 centimeter, you can observe him. Otherwise, if you have patient with high risk, like more than 50 years, he has large size, he has tension pneumothorax or hemodynamic instability, these patients are candidate for chest tube insertion according to the updated guidelines. Is that clear? You have to observe only the patient with no symptoms and the pneumothorax less than 2 centimeter.
No, I mean for this patient who has COPD, who
Yeah,
will put the chest drain? Is it the medic or the surgeon?
never the medical insert chest tube. It's a surgical procedure and it should be inserted by surgical or thoracic surgery doctor. So
What?
the best,
I've done it. I'm a medic, and I've inserted a chest drain last month.
according to the policy in the hospital, but basis wise, and what makes sense, the medical doctor to insert or to the surgical doctor?
But it's one of the competencies for internal medicine
Yeah, so
training.
it depends on the department privilege. Maybe some ICU doctors can insert as a medical doctor, particularly if the patient is having tension pneumothorax, right? But as privilege wise and guidelines and policy, the surgical and not only surgical doctor, the thoracic surgical doctor, particularly if you are working in the specialized hospital, they are referring for that. If they allow you, this is policy of the department. It depends on the hospital itself, from hospital to hospital. But for the safety, they are doing it by the specialized team. You got it. So follow the scenario, basis wise. If you are not mentioned to be inserting the tube yourself, say we will do a referral to the surgeon to do it, or we will refer you to the specialized team. Don't say I will be the one to insert. Okay?
Yeah.
It's basis exam. It's exam of show. How to show that you are working with a team, not you are the team.
No, no, no. Of course, I understand it, but it is one of
Yeah.
the competencies for medical trainee. They don't need to do it unsupervised, but they need to do it supervised. And usually, the respiratory registrar will do the ultrasound, and he will be
Okay.
there to supervise you. You're not gonna do it
Yeah.
on your own.
So again, it depends on the hospital policy. If they allow, it's okay. Some hospital they are not allowing. Why? Because it's really sometimes life-threatening procedure. If you are very aggressive while inserting, you might hurt the lung and cause more injury. You might have hemothorax. So instead of managing and treating the patient, you will have complication. Sometimes surgical emphysema also can happen as a complication, the air under the skin, and it will need more time to treat. Okay, instead also of being 2 days or 3 days for the chest tube, the patient might need more than a week. So it's a safety point and depend on the policy. Basis exam concept. This is not the team. It's a team job, not as a doctor job. Okay, you are never be explaining and doing the procedure in the exam. Supposed to refer to, unless you are the one written in the scenario, you are the thoracic surgery doctor, and I don't think they will put it in this way. Why? Because this is medical exam. Okay, so your hospital may be exceptional and other hospital as well, but as a general rule, the one inserting a tube is the surgeon. Clear?
Some hospital, Dr. Basim, even the surgeon not allowed if there is cardiothoracic team there. They are doing
Yeah,
it.
thoracic surgery, exactly. So not
Yes, he is
yeah,
the priority.
unless exactly. If it's a specialized hospital, they will call the thoracic surgery to insert it. If he is not existing, they can call the general surgery to insert and the senior one. Why? Because they are not familiar with this procedure. But
Even
if
the
they're
high,
thoracic, sorry,
even the highly trained ICU doctor and
yes,
surgical doctor, sometimes they are not doing except if it is emergency. He will be asked how he will leave tension pneumothorax. It will be diagnosed clinically, even by ultrasound, not waiting
yes,
the X-ray. He will tell you how you are seeing the patient like this, and you have the prep to do, and you are not doing. Even he will not allow you to call anyone. So
exactly,
only this is the only case that the highly trained ICU and the normal
yes.
surgeon طبعا he can do it.
Yeah, so it depends again on the hospital policy. But by the way, if you have tension pneumothorax and you are in the hospital, in the ICU, you can do the needle decompression, as you know, waiting again for the surgical doctor to come to insert. So it depends, but this is not, it's beyond the basis exam. We are here to talk about the procedure. It will be done by the team, not by you. You are involved in the team. Show always the examiner you are talking as multidisciplinary team, or one of the team as a teamwork, and you are one of the members of the team. Because he might ask you, even though no question here, he might comment that you are doing everything by yourself. You are doing the consent form, you are talking, explaining the procedure, you are the one going to insert the tube, which is not your specialty. Okay, not only in this scenario, and any scenario, unless they wrote for you, you are the doctor in the thoracic unit or the surgical, but you are not the surgical doctor, of course, because this is MRCP for medicine, right? So don't, or never ever say, I will insert the tube myself. I will refer to the doctor who will be assigned to insert it. Clear? If you're ready, Dr. Inas, we can start the next scenario. Before that, we ask the last question. Any question before starting the second scenario? Anyone want to comment? Is it clear for all? Let's start. Dr. Inas, ready?
Yes. Oh,
Yes.
hello. My
Okay.
name is Dr. Inas. I'm one of the doctors here today. Can I confirm your name and your age?
Sorry, Dr. Inas, can you restart again? Dr. Muhammad, you are there?
Yes, yes, yes.
Uh,
Hello, doctor. I am Farouk, 50 years old. Yes.
oh, nice to meet you, Farouk. Is it all right to call you Farouk?
Again, Dr. Muhammad?
Yes, doctor, I am here. Yes, yes. Can go on.
So, sorry, can we start all over again?
Yeah, better. Okay, here you go.
Okay. So my name's Dr. Inas. I'm one of the doctors here today. Could you please confirm your name and your age?
Yes, doctor, I am Farouk, 50 years old.
And is it right to call you Farouk?
Yes.
And I understand that you came in today with some gait issues and problems with your walking. Could you please tell me more about that?
Yes, doctor, I am suffering since 2 months from this issue. I can't walk, I can't have some problem, some abnormal movement. I can go to my work, doctor.
Oh, I'm sorry to hear that. I'm sorry to hear that. And has that been there every single day or comes and goes?
Comes and go, doctor, but more nowadays.
Okay. And are you worried about something in particular?
Yes, doctor. Yani, I know that any of this muscle problem, maybe some stroke there, maybe some cancer there. I don't know, but I don't. I wanted to know what's happening for me.
Well, to be honest, all of these are valid questions. However, I'm more than happy to reassure you that after examining you and doing all the scans, everything is very reassuring.
So, doctora, you mean I am pretending or acting, right?
No. I'm not saying that. Well, why are you saying that? Why do you feel that I've...
Doctora, my job will be my manager will fire me. He's telling like this, so that I'm telling you.
Oh, I'm sorry to hear that. It must be a lot of mental stress that you're going through. So, the symptoms that you're having are real, okay? But when we looked into the scans, we did not find any abnormality that would explain these symptoms. This does not mean that the symptoms are not genuine. They are genuine, they are real, but the problem is not in the hardware of the brain, it is more in the software of the brain. Do you understand what I'm saying?
No, doctora, I can't understand what you're telling.
Okay. I'll repeat it in a simple way. So you've had the difficulty in the walking and you've had a bit of issues in your gait. And when we see this as medics, we think of a cerebellar problem. The cerebellum is one part of the brain that's responsible for our balance, okay? However, when we've done scans of the cerebellum and the whole brain, all scans were reassuring, which is great. Now, why your body is behaving and presenting with these symptoms, it could be because of a significant stress, for example, that you're going through. Have you been very stressed recently?
Yes, doctor, I have some stress in my job, as I told you.
It must be hard. I'm sorry. I can only imagine the mental stress you're going through.
So, doctor, I heard there is some scans more accurate with dye, with some magnetic. Please do it for me. I need document for my job to help me.
I can see where you're coming from. No one at the end of the day would like to have symptoms and they do not understand where they're coming from. However, it's been noted. So I'm not sure if you ever heard of other illnesses like irritable bowel syndrome. So irritable bowel syndrome, like these people will have problems with their abdomen. They might have diarrhea or constipation, abdominal pain, and when we investigate them, we will
Doctor,
not
what all
find.
this? Sorry, what all this? I can't understand all this. I need imaging more accurate, doctora, with dye or something for me to send it for my job to me to believe me that I have a problem. Only do for me this, please.
I can see where you're coming from, but I can reassure you that all investigations that we've done were reassuring. And having another scan with a dye might put you at risk of having complications from the dye rather than getting benefit because we're not really expecting a change in the results, if that makes sense.
Wait, doctora, what you will do for me now, please?
So, I think, first of all, thank you very much for coming to see us. I think solving a problem relies mainly on diagnosing the problem at the very first instant. So today, we found that there is no problem in your brain, which is great. Now, regarding the symptoms, we can work on them together to help the symptom. And I can refer you to a specialist team in the hospital who might be able to support you moving forward. Would you be interested in that?
What team, doctora?
So first of all, we have psychotherapist and a mental health team. The mental health team will help us to dig into finding more why you've developed these symptoms. Because like I said, when we did not find any structural abnormality in the brain, it could be a functional abnormality of the brain. Like I explained earlier, the problem really is in the software rather than the hardware. And the mental health specialist, they do have a fantastic way of digging into these kind of symptoms and find exactly the root why you've developed these symptoms, and they will be able to help you to go through this challenging time. Would you be interested in something like that?
Doctora, but again, you are telling me psychic, mental. I am not mad, doctora. Please, I need medication or I need something to help me.
Of
What?
course, of course, of course, of course. I'm not saying by any means that you're mental or psychic, and I'm really sorry if you got that from me. And I just want to make sure that I am clear. We call it the mental health team because it really works on the mental health. And we call it psychotherapist because they work on the psychology of our bodies.
So how they will help me, doctora? They will give me medication?
So there are some ways where they can give you some medication, but there are other ways where medication is not needed. So sometimes they will do something like talking therapy or cognitive behavioral therapy. And I'm more than happy to explain to you in details about these. But at the moment, I think it's very important for you to be reassured that all of your scans are normal because I'm quite worried that you would still have that vicious cycle in your brain that there is something wrong.
Okay, Doctora, thank you.
I can see that you're not very happy. Is there anything that I can help you with?
2 minutes left.
No, I understand now, Doctora, there will be some talkative therapy. They will sit with me as psych doctor or mental health doctor. He will sit with me and they talk with me and he will help me. That's okay. That's it.
Okay, and yeah, that's pretty much it. And I just want to let you know that if any time you became ataxic or you were unstable in your feet and you noted that your gait is not stable, please come to A&E. It's very important that we rule out an organic or a structural cause before we assume that it is a functional illness.
Okay, Doctora. I will come in time.
And in terms of your work, would you like me to sign you a letter that says that you suffer from these symptoms and for the time being you wouldn't be able to do this or that work?
Yes, please, Doctora. Yes, it will help me too much.
Yes, of course, we can do that. And I just want to say that employers are obliged to make sure that their employees are very looked after. And if you feel that you would need this letter to be again reissued for you, you can ask your GP to get that letter for you, like I said. And oh my God, this is very difficult. I'm sorry. And we can ask your GP to get this letter again for you. I just want to let you know that you're not alone in this. And if you'd like, I can put you with the patient support groups within the hospital. They might put you in touch with people who have been through the same situation or through the same condition. And at that point, you would be able to reflect based on other people's experience, if that might help you.
Yes, yeah. Yes, Doctora. I will be happy for this.
Okay, that's great. I'll give you a leaflet that explains about the functional disorders and how they appear. They can appear in many systems. It can appear in the abdomen or the nervous system or whatever. And if you have any questions, please let me know.
Okay.
Yeah, Doctora,
Time.
thank
Yeah, time's up. Already 40-second added. Thank you, Dr. Ines. Well done. Dr.
Sorry,
Mohammed.
Doctora Ines, to be little harsh. Sorry.
نعم.
Sorry to be little harsh.
Oh my
Sorry.
God.
They will be like this at exam. Sorry for this.
Okay, Dr. Mohammed, your comment?
Yes, I will confirm. Thanks, Doctora Ines, for taking the case. Firstly, I did most of the point, but the problem, too much jargon. You are not give. I am a doctor. I should understand more easy. I can't. Even me, so much. You take more than 20 seconds or 30 seconds. You should every 5 seconds or one statement. You should be sure I am I understood what you are telling. This is very important point. I noticed. Second thing, be more simple. For such cases, he was coming angry and a stressful life. He need more simple, to be more simple, more direct. You are the most important. You tell him your symptoms are real. This is very important to mention. Your case, your condition called functional disorder, which means there is abnormal brain reaction to the surroundings. Sometime for stresses, you have any stresses in your life. Only this statement is enough. That means that there is some abnormal reaction to the stressful condition, and he will confirm on you that I have, yes, doctor, I have too much stress. I need some help. Then you can prove for him. He will be more happy. This is the brain. This is some nerve cables. Sometime when you have some stress, the brain understood something abnormal and send this signals to your body to give this abnormal movement. But you are this condition well known to us, and we know it, and we have many conditions like you are right. You are not pretending. You are not acting. We know this condition well, and we are here to help you.
Okay.
How can you will help me, Doctora? Please do for me a CT another dye scan, magnetic scan. My friend told me about this. It will help me in my job to give them evidence I am sick. I appreciate your concern. I appreciate your knowledge. But as I told you before that, we did all lab and all scan and everything is okay. And on the other side, this scan that you want to dye have a harmful effect, like as you mentioned, طبعا you mentioned this from affecting your kidney, radiation may increase cancer. So at the end, we are expecting that the same result will be there. Okay, Doctora, I am suffering in my job. What you will do for me? Okay, I appreciate you. Your words is valid. I know. I feel. طبعا your sympathy and empathy very very nice. Yeah. But I will give you that letter, this report, to the occupational health to reallocate you in another job. You will be more comfortable. Your stress will be better, or I will give you sick leave until this problem fixed. Then he will tell you, okay, Doctora, no medication for me. As you mentioned, we have a good team here, counselors, including social worker. No need to tell mental health. Sometimes this is a jargon, and he maybe misunderstand the math. Even psycho, he will understand the math. We have a good team. Many counselors we have, social worker we have. They will sit with you. There is a talkative therapy called cognitive behavior therapy. This is a talkative therapy. You will sit in groups. This team have many techniques and many plans and many many plans to help you. Even there is something called relaxing exercise therapy. You will be in groups. You can express your stresses in front of them, and they will help you too much. Doctor, you are telling me like I am a mad. I appreciate your knowledge, but this if you tell a psycho doctor or mood doctor, you will tell him, assure him that mood doctor not only for the mad people. He are sitting and talking and see what stresses you have to help you. Sometimes he give you some medication for stress, maybe help you too much. Alles finish and you assure him, he become more relaxed and start the social. What's your job, by the way? My job like this. If you ask me, I will tell you I am physiotherapist. So he will be affected too much, and this is cause him the stress that he can't by this abnormal movement how he will work. So you will be sympathy with him and give him the letter as we mentioned. Second thing, very important, you are driving. Yes, I am doctor. I am driving to my work. How does it affect you? Sometimes I am not good, doctora. Please stop driving for a while until we fix your problem. Any risky hobbies? Yes, doctor. I am I am a swimmer. Please also be supervised until we finish this. Then, as you mentioned, I will give you some brochure to read about and finish the case. Okay. Thank you, doctora. You fulfill most of the point, but the problem, as I mentioned from the beginning, you are more detailed, more jargon, and he will not be happy to not understand what you are telling for him. Be simple and be target, and he will be على طول after he becomes stressful at the beginning, he will be relaxed, he will be happy and start the social. Okay.
Okay.
Thank you very much.
Yeah. Thank you, Dr. Muhammad, for the comment. I will add only to your comment that in UK, I think Dr. Inas in UK, right? So you will have exam in UK centers. They are accepting most of these jargons, like abdomen, like psychotherapist, and mental health. I believe they are accepting from my experience, what I faced with the other candidates in UK. So they are accepting some of these jargons like fever, like abdominal, as I said, abdominal pain and whatever. Again, to be more simple, it's much better than maybe might be some examiners will not accept these jargons. So the best way to be as simple as much as you can. Okay. As Dr. Muhammad said, the mood doctor will sit with you to check if you have any change in your mood, rather than saying psychotherapist. Psychotherapist is a very complicated word. Maybe he will misunderstand that, like you are um, pretending he has some mental issue or psychic issue. So the best way is to say the mood doctor. If you had any change in your mood, he can sit with you. He can manage this. Again, the topic about functional is not only, you mentioned it in the whole scenario, it's not only neurological issue. You might have sometime tummy or abdominal issue like irritable bowel syndrome. You might have like multiple sclerosis, the weakness, so conversion disorder, or these things called as functional disorder. It might happen, and the same concept, the same address, and the same explanation. Whenever you have stress, the brain is overreacting to this stress by this reaction, and the reaction will be reflected into your body, either weakness or whatever he has. Is it real? Yes, it happens. And to treat it, we have to remove any stress in your life. So it depends, or it's related to the stress. Whenever the stress is released, you will be fine. How to remove the stress? So ask and address the stress in his life. Any stress of his life, you should manage by referring him to specialized team or group of specialists. They will sit with him by what way according to his stress, either as doctor, and you said also cognitive behavior, talkative therapy, relaxing, yoga, vacation. All these are solutions. It's not only the mood doctor. Okay. The good thing also, Dr. Inas mentioned, is it by medication? Sometimes by medication and others with no medication. Okay. Some situation needs to be taken. I mean, medication might be taken. And you, if he asks, you can say some of the antidepressants. But don't say antidepressant, some of the mood stabilizer. Okay, don't say antidepressant, but it's antidepressant medication like tricyclic antidepressant and amitriptyline, I mean. So it might be there, but after trying non-medical way or non-medication or no medication option, if still the stress there and you feel less sleep, you are not having good life and affecting your life and your job, we might now start some medication with low dose. It's called mood stabilizer to be sure that you don't have any change in your mood. Of course, it will be another task if written in the scenario, talk about medication or pharmacological option. In this scenario, I don't think you will be, our scenario today will be only focused on the non-medical way or non-pharmacological options, which as you mentioned already, and Dr. Muhammad. Okay, if you have any stress in your work, you can offer some vacation. You can offer some hobbies he can do, yoga, exercise, swimming, your hobbies, take less working hours. Okay, it will help. These are the options you can offer to any patient having the functional disorder. In general, Dr. Inas, you did it perfect. Again, as UK centers, they can accept your performance. Even they can appreciate it, and you can do a good mark. Okay. Any question? Don't forget Dr. Inas the job. Okay? It's one of the hidden points, as we'll add driving.
Okay, thank you very much.
Yeah,
Thank you.
yeah, most welcome. Anyone has comments? No, I was about to die. No, no worries. By the way, even at the end, I was wondering why you are saying I did wrong. No, you didn't wrong. You didn't do wrong. You were perfect till the end.
Thank you. Thank
Okay.
you.
Yeah. Okay, I will go to the comments. Dr. Ihda, urgent assessment means scanning was done or means a clinical assessment because no mention of term scan was done. Whenever the consultant decided, means there is scans and labs investigation done. Even he can explain to Dr. Ihda in the introduction. I have done a lot of scans. I have done a lot of blood tests, and what are the results? The most important point and how to explain, you have to say it's reassuring. This is the best way to say about functional disorder explanation. It's the results are reassuring. Okay, this is the best words. This what I prefer to say it. All labs and scans or all blood tests and scans are reassuring. You don't have something serious. Yes, he is presenting with symptoms, but these symptoms it's called functional disorder. Let me explain about it and proceed with the explanation. The other comment, Dr. Ihda, so we would talk only about clinical assessment. No, supposed to be with some image, particularly if you have something like a neurological manifestation. But for irritable bowel syndrome, it's not, usually they are not doing any image. Okay, Dr. Hida. But if you have weakness, you have numbness or tingling, so these are the disease or disorder needs to be scanned, particularly the brain. You cannot depend on just clinical manifestation or clinical assessment, particularly if you have weakness. You have to rule out something serious. Okay. For the irritable bowel, I don't think they can do CT. They can do only ultrasound, something non-invasive. But they will not. They will never go for CT abdomen or even using contrast, unless. So always give the red flags unless there is blood in stool, for example, or patient is having high frequency or more frequent diarrhea or loose motion or loss of weight, loss of appetite. So these are the red flags also we can offer at the end of any functional disorder. Okay, it's advisable at the end of this scenario, Dr. Inas. Please, I think you did it. Whenever you have unsteadiness, again, come to us. But if you give this instruction, he will come to you every now and then. Whenever he has stress, he will have ataxia and disability or unsteadiness, he will come to you. So the best way is whenever you have manifestation different than you are presenting usually. Okay, for example, if you have severe headache or if you have unsteadiness different than the one you are having usually, or you have weakness which is different than you are having usually. Why? Because he has the same presentation every now and then. If he will have it every now and he will come to you. So what the benefit of your sitting today with him? Why you sit today with him? You are encouraging him that you don't have anything abnormal. And at the end of the session, you are telling to him, if you have this unsteadiness again, come to us. So you didn't treat it. You didn't explain it well. However, if you want to say something different, or if you want to alarm him about something, he should take care of it if the symptoms changed. Whenever you have change of your manifestation, or you have severe headache that you are not tolerating, or you have new blurring of vision, something which is new, please visit us. Why? Because it will be alarming, something need to be scanned or investigated. Clear, Dr. Ina, at this point?
Yeah, thank you very much.
Yeah, so don't let him come for the same manifestation. No, let him come if he has different manifestation. Alarming thing. I hope it's clear for all. Okay, yes. Yeah, Dr. Ida also confirmed that it was good talk, really. It was good performance, Dr. Ines. As a first time, by the way. You did it as a first time, right? So at the first time, it's perfect. And again, they are accepting this in UK centers. Don't worry about the jargons. But try to be more simple, better. Okay,
I
thank
will.
you, Doctor. Okay, anyone want to comment or ask question? Any point need to be clarified? Functional disorders is a trending scenario. It might come every diet. You have to know how to address the stress for any patient, any type of stress. So it's clear for all. Any question before ending the session? If no more question, we can end the session. Thank you, Dr. Muhammad, Dr. Inas. See you tomorrow, inshallah, with long clinical consultation day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you very, very much. And thank you, everyone. Bye bye.
Most welcome.